The treatment of certain heart conditions by homeopathy by Douglas Morris Borland. Section Chronic Heart Failure. Lachesis and nausea. In all these cases, indicating the snake poisons, there is rather purplish bloated appearance. They all suffer from a feeling of tightness or constriction in the chest, more commonly in the upper part of the chest, and they are all intolerant of any weight or pressure of the bedclothes or any tight clothing around the upper part of the chest or the neck. All are sensitive to heat. They feel hot and they dislike a hot, stuffy room. They all have a marked aggravation after sleep. They get acute suffocative attacks when they fall asleep, and they wake up in increased distress. All these snake poison patients in their cardiac distress have a marked aggravation from being turned over on the left side. All of them have a very marked tremor. Their hands are shaky, and most of them, as they tend to get worse, become mentally fogged, confused, and very often they tend to become difficult and suspicious. If there were nothing more than that, one would give them lachesis. But in certain number of these cases, there are rather acute stitching pains which go right through the chest from the precordium to the region of scapula, associated with very marked numbness, particularly in the left arm and hand, and where the numbness is pronounced, one tends to give nausea in preference to lachesis. If the stitching pain, is more marked, one tends to give nausea. If the feeling of constriction is more marked, one tends to give lachesis. But their general symptoms are identical. I think possibly nausea is a little less red, less bloated looking, a little paler than lachesis, but that is not very striking. To my mind, the choice of one of the other snake poisons as distinct from lachesis and nausea in such cases is always governed by the general symptom picture rather than by the purely cardiac picture. For example, one may require Crotalus horridus in case of failing heart associated with acute sepsis, but one would be guided to the choice by the septic state rather than by the cardiac symptoms per se. Lycopas. One gets indications for lycopas in a case in which heart is just beginning to fail. It is beginning to dilate a little, and the pulse is tending to become a little irregular. The patients tend to be pale rather than cyanotic, and they are always restless. The outstanding symptom of the lycopas case is that the patients complain of horrible tumultuous sensation in the cardiac region. They very often tell one it feels as if their heart had suddenly run away and was going mad. This is accompanied by a feeling of intense throbbing extending up into the neck and right into the head. The other lycopas symptom which helps one is that accompanying this tumult taking place in the chest, there is a very marked tendency to cough. It feels as if the heart just runs away. It sets up an acute irritation and they cough. Another lycopas distinguishing symptom is that their distress is vastly increased by turning over on the right side, a contrast with a snake poisons which was worse turning over on the left side. Lastly, these lycopas patients have an intense dislike of any food, particularly the smell of food. Laurocerasus. The Laurocerasus picture is very definite, and I find the easiest way to remember it is to the picture to oneself, the appearance presented by the congenital heart of about 16 to 18 years of age. You know the peculiar bluish red appearance of the congenital heart somewhat clubbed fingers, which again are rather congested, and the peculiar bluish appearance, almost like ripe grapes, of the lips. That is the sort of underlying color one associates with lyrocirrhosis. These patients always suffer from extreme dyspnea, and the type of dyspnea is very nearly shine strokes in character. They take a sudden gasp for breath, then 2 or 3 long breaths, then the breathing gets gradually shallower, then a pause, then 2 or 3 gasps, and so it goes on. Another feature is that the respiratory dyspnea gets very much worse if they are sat up. They are better in a semi-prone position. There is marked tendency to the early development of hypostatic pneumonia in such cases, and once this has appeared, the patient's cough is more troublesome unless they are reasonably propped up. When lying, the cough is worse. Sitting bolt upright produces a feeling of extreme constriction of the chest. Semi-prone is the position of choice.